Hi, good morning everyone. So today myself Kushi Arora and my group mates Amandeep Kaur, Harpreet, Jyoti and Sukhveer, we are going to present collaborative group project part 2 of community health nursing. So our vulnerable population is adolescents of parents with substance use disorder in Toronto, Ontario. And why we have chosen this population? Because parental substance abuse significantly affect adolescents. The adolescents of parents with substance use disorder are vulnerable because they are at increased risk of facing direct consequences like abuse, neglect, and indirect consequences such as lack of resources by their parents. And what about the parameters of the community? So the age of adolescents will be 10 to 19 years of age group. Location will be Toronto, Ontario. And the study will target only the adolescents whose parents have a diagnosed substance use disorder. And the socioeconomic status, which include the factors like family income, parental education, and employment status. Since Toronto is a multicultural city, so the cultural background of the families will influence their experiences and needs. So next one are the stats. So what are the stats here? A study shows that from 2018 to 2020, 540 patients 10 to 19 years of age were admitted, which included 126 had substance use disorder, 124 had a history of psychological diversity, 90 had parents with substance use disorder, 55 reported being bullied, and 54 were sexually assaulted. So next will be covered by
Covered by her.
Harpreet.
Thank you, Kushi. So my topic is type of assessment, how we choose, how we assess these things. First one is the approaches. We conduct the surveys and interviews to assess them, and the next one is the focus group. We specifically identify the adolescents who are suffering from these conditions. Next, we have to analyze data which is already collected. Next, we are using the tools and resources. First is the questionnaire methods. Second is the data assessment tools, and third is the interview guides. And next, why this assessment? Why we choose this assessment? There are particular reasons behind it. The first one is assess their particular needs. The second is provide guidance for program development. And the third one is proper distribution of resources. And the fourth is monitor the development. And next, is why to access the where to access the information. The first one is local social service organization. They have all the collected data with them. Second is the educational institutes where the adolescent is studying, like their behavior and their attendances. Next is the healthcare providers who are working in the clinics or in the hospitals. And the next is community surveys. And the fifth one is the government statistics and reports. Next is why these resources, why we choose these resources. They are relevant and they are accurate and their comprehensiveness in thereby nature. The next slide will be discussed by Jyoti.
Thank you, Harpreet. So I'm going to represent what is going on in this selected community. So first one is that high prevalence rate. Then in this selected community, in which parents have substance abuse disorder, they have high prevalence among the children's prone to getting emotional, behavioral, and academic issues. Second one is adolescence impact. Increased risk of experiencing emotional, behavioral, and academic issues. Third one is health and social services. They have limited access of socio-economic condition. Next. So in the next slide, in community strength, we're gonna recover three strengths: support network, health services, and educational program. First, support network. We have multiple organization and peer support group which strengthen this issue particularly. Second one is health services. We have mental health services and addiction treatment centers for the vulnerable population. Third one, educational program. We have specialized kind of program which are held in the schools particularly for public awareness. Next, challenges ahead in this particular process. People have stigma and social isolation because their parents is substance abuse. Second one is they have limited access to the healthcare facility and inconsistent services. Third one is economic barrier, which is the main barrier which hinder the services from this particular population. Next, capacity building strategy. Capacity building strategy we gonna use for represent this issue. First one, education and awareness, public awareness and stigmatization efforts. And second one is enhance support services by providing the support services they need. Third one, community engagement by engaging the population in their treatment plan. Fourth one, policy advocacy, advocate for their rules and regulation and their rights regarding their health services. Last one is mentorship program for guiding them for particular future benefit. Next, organization and services gonna be covered by Sukhveer.
Thank you, Arpit. So, thank you, Jyoti. So, what are the organizations or services? The first one is Center for Addiction and Mental Health. The second is Children's Aid Society of Toronto that offers protection and support for the at-risk children and families. The next one is Canadian Center for Substance Use and Addiction. And the next is YouthLink. It is also a Toronto-based organization that provides mental health support, housing, and other critical services to the youth in need. The last one is Toronto Public Health that enhances community health with programs for mental health and disease prevention. So these are the organizations or services that provide the support to the youth. Uh, so next are the gatekeepers and stakeholders that include school counselors and teachers, healthcare providers, social workers, uh, in stakeholders, parents and guardians, adolescents, community organizations, local government, and health authorities. So next one is the communication strategies. These stakeholders and gatekeepers communicate by direct meetings and briefings, workshops and seminars, surveys and feedback forms, collaborative partnerships. So next one, the voices they may not be heard. And that include adolescents themselves, marginalized communities, parents with substance use disorders, and service providers. And these are the so next part will cover by Amandeep.
So next is engagement in the community assessment. First, focus groups and interview. It includes relaxed sharing, thorough one-on-one interviews, and focus groups run by peers. Then surveys and questionnaires. It distributes of the Google Forms that organized surveys and promote participation and privacy. Then community events and workshop that arranges sport groups and informating fairs and seminars. Then social media and digital platforms, collaborative partnerships. Then next are the strength and limitations of the approaches we choose for this community assessment. Firstly, strength makes use of trust and current networks, offer detailed qualitative insights, use anonymous questionnaires to reach a sizable sample, create a sense of good and community, and provide prompt assistance, use well-being and exhaustive platform targeted for teenagers. So next are the limitation, that's a coordination difficulties. Sometimes it's time consuming, danger of bias and poor response rates, restricted access to isolated populations and places, possibilities of uneven data quality, then challenges in sustaining sustained involvement. So moving to the next part is additional strategies that we use, like involvement of parents, community-based participatory research, mobile outreach programs, peer researchers, provide safe and secure environments using the proper and effective communication. So next are advocacy consideration. Firstly, reduce stigma. Advocate for reducing stigma around substance use disorders. Improve access for better access to mental health and sport services. Provide proper policy change. Next is ethical consideration. Ensure confidentiality and respect adolescents' privacy. Obtain proper informed consent. Avoid harm or additional kind of stress to participants. Aim to benefit adolescents and their families. Ensure inclusive and equitable assessment process. So these are references. Thank you.
Thank you.